Did you know that migraine is the third most prevalent illness in the world? And nearly 1 in 4 US households include someone with this problem. Hi viewers, and welcome back to Bestie. A headache can be quite troublesome, which can affect your day-to-day functioning. There are several types of headaches, but one of the worst ones is a migraine. Due to hormonal factors, migraines are believed to affect women more than men, and they typically run in the family. It's often difficult to tell the difference between migraines and headaches. Both can lead to a lot of pain caused by identifiable triggers or set in without warning. In today's video, we'll tell you what ways to identify whether it's a migraine or a headache. From pain intensity, diagnosis, causes to treatment options, and more. Watch until the end to learn about all of them. Number 1. Triggers and causes. Triggers for a normal headache can vary. Sudden stress and anxiety can start symptoms. Some patients may have depression. Poor posture can lead to musculoskeletal problems, which then trigger headaches. Other causes may be tiredness, dehydration, hunger, smells, squinting, noise, and sunlight. Triggers for a migraine can come from many sources as well. Initially, they're thought to start from chemical reactions in the brain. For some people, a migraine can be prompted by hormonal changes. Some women experience migraines around menstruation. Also, menopause can have an impact. It can make migraines worse in up to 45% of women who are going through it. Low blood sugar and hypoglycemia from not eating can trigger migraines as well. Alternatively, eating a meal too high in sugar can have a negative impact. Other causes can be emotional anxiety, physical factors, exercise, contraceptives, medicines, dehydration, alcohol, computer screens, and diet. What are your most common triggers for a headache? Tell us quickly down below in the comment section. Number 2. Frequency. Migraines are typically a reoccurring problem. The rate at which you experience headaches alone isn't a good indicator as to whether you suffer from migraines. Chronic headaches occur more than 15 days per month and include both regular headaches and chronic migraines. Migraines typically interfere with your ability to function, whereas normal headaches do not. If you have a light or noise sensitivity as well as nausea or vomiting, you may be experiencing a migraine. It's possible to have frequent headaches that aren't migraines. Talk to your doctor if you experience chronic headache pain. Number 3. Pain intensity. Migraines often cause severe, debilitating pain. They are usually characterized by throbbing or pulsing. It's also possible for the pain to be constant rather than the pounding typically associated with migraines. Normal headaches usually affect both sides of the head. Migraines can cause pain on both or just one side of your head. You may feel the pain in your temple, the neck, or behind your eyes or ears. Number 4. Diagnosis. The process of detecting headaches and migraines is almost the same. With any kind of headache or migraine, your doctor may ask you things like, do other people in your family have migraines or other kinds of headaches? Do you have any allergies? What is the level of stress in your life? Do you notice that your headaches start after coughing or sneezing or after intense exercise? They'll do tests to check other conditions that could cause your symptoms. You may have blood or imaging tests, like a CT or MRI. Symptoms of a migraine with aura can look like a more serious condition, such as a stroke or a seizure. The first time you notice an aura, it's important to get medical care right away to find out what's going on. Once you've made sure there are no other issues, you don't need to see a doctor every time you have that same aura. But if your symptoms change, make sure you check in. Have I caught your interest? Well then, hit that subscribe button and watch more videos. Join our millions of followers for more amazing Bestie content. Number 5. Types of headaches. There are multiple types of headaches, so analyzing the nature and location of the pain may help determine the cause. First, let's talk about tension headaches. The pain that occurs from tension tends to spread to all sides of the head, often beginning from the back and creeping forward. This is the most common headache pain. Stress, eye strain, and hunger are random causes of tension headaches, and they can be chronic. Second is sinus headaches. These headaches often strike when you're feeling congested or sick. They're caused by swelling in the sinus passages, turning into pain behind the nose, cheeks, and eyes. The pain is often at its worst when you wake up in the morning and you bend forward. And finally, we have cluster headaches, which are generally painful and occur in clusters. This means they happen frequently or daily, sometimes many per day for months. They're a result of dilation in the blood vessels of the brain due to release of histamines and serotonin. They can be caused by bright lights, physical exertion, and even altitude. Number 6. Types of migraines. Well, they're not necessarily different types of migraines, but there are phases of it. The first one is the prodrome phase, sometimes known as pre-headache phase. This stage features painless symptoms that occur days or hours before the migraine arrives. These include food cravings, mood swings, and stiffness of the neck. The second one is aura phase. Auras refer to sensory disturbances that occur during or before a migraine. These can affect a person's touch, vision, or speech, though not everyone who suffers from a migraine will also get an aura. Examples of auras include a blind spot that expands over time, blurred vision, slurred or jumbled speech, and numbness in the arm. The third one is the headache phase. This is when the pain generally hits, and it may range from mild to debilitating. Physical activity and exposure to smells, sounds, and light may worsen the pain. However, some people can have a migraine without any headaches. And finally, there's the postdromal phase. In this phase, people may feel exhausted, confused, or usually unwell. This needs proper treatment, and before you jump into paying some huge amount to the hospital, first buy health insurance. Number 7. Natural treatments. Massage, relaxation, and stress reduction techniques are very beneficial in preventing headaches. In addition, limiting screen time and getting enough sleep are essential to stopping this pain. When needed, over-the-counter medications such as acetaminophen and ibuprofen can help alleviate headaches. Another effective treatment is the use of trigger point injections. Your doctor can talk to you about this form of therapy. In addition, your doctor can prescribe both preventative medication and drugs to stop a migraine once it starts. One of the best techniques to avoid migraines in the first place is to keep a food journal so you can identify any potential food triggers. Many patients can prevent migraine headaches simply by eliminating certain foods. Some patients also found relief through yoga, meditation, and hypnosis. In addition to migraines that tend to be cyclical and hormonal, addressing any hormonal imbalances can help prevent the onset of migraines. Yoga is one of the best ways to take care of your mental health, which is great for migraines and headaches. Learn more about the health benefits of this amazing exercise by watching 15 health benefits of doing yoga for 10 minutes every day. Now back to unbeatable ways to differentiate between migraines and headaches. Number 8. Treatment through prescription drugs. Over-the-counter painkillers, including those that contain ibuprofen, acetaminophen, and aspirin, work best when taken before your migraine gets really bad. Regular headaches often respond to these as well. You could also experiment with natural headache remedies. There are some prescription medications that are classified as abortive because they head off the pain before it intensifies. They're available in many forms, including nasal sprays, rapid dissolving tablets, and those that can be self-injected. If you get a migraine once a month or every 6 months, an abortive strategy may work. But if your migraines occur more frequently and are moving into a chronic phase, you should consider preventative migraine treatments. The newest class of prescription meds is CGRP. This is the first class of drugs designated specifically for migraine prevention. There are currently 4 CGRP drugs approved to prevent migraines. 3 are given as monthly injections and 1 is given quarterly as an infusion. Older migraine prevention drugs were designed for conditions other than migraines, such as seizures, high blood pressure, or depression, and are still widely used. Devices that apply electrical or magnetic stimulation to the head, neck, or arm can dampen pain signals and help treat or prevent migraines. How to figure out which type of headache you have. It's not always easy to tell, as there's an overlap in symptoms and you can experience different types of headaches. Keep a headache diary. This is a powerful tool. It allows you to get ahead of your headaches. Start by simply drawing an X on a calendar every day that you experience a headache. Once you get the hang of that, start to detail the characteristics of your headache. What does it feel like? How long does it last? What medications did you take? Did they help? After diving into the characteristics, dive into your triggers. This information can help you and your doctor figure out what type of headaches you're experiencing and what triggers them so you can stop your headaches before they start. Regular throbbing headaches may be a sign of something more serious, like a brain tumor. Learn how to identify its signals by watching 10 warning signs you have a brain tumor or 7 early signs of a brain tumor you need to know about. So go ahead and watch one or both of these videos for maximum benefits. Have you ever had a migraine attack? How did you deal with it? Let us know in the comment section below.